Hi, this is Rod Rorick from Dallas, Texas. We're live from Dallas as well as Redding, California. Tonight, usually it's sunny in both these areas, but it's kind of raining today. But we're going to have an amazing interactive session today with two phenomenal, experienced injectors, and we're going to talk about QWO, the only FDA-approved injectable for the treatment of cellulite. So let's start with our introduction. And David Weir is my nurse practitioner in Dallas, Texas. David, tell us a little bit about yourself.
Yeah, like Dr. Ork mentioned, I'm a nurse practitioner, family practice. I've been in aesthetics for on and off for 20 years. I found joy in using QWO, and I like to talk about it. So hopefully I can offer some insight in my experience, and you can get some good questions answered.
Good. And then we have Julie Bass Kaplan, who's a nurse practitioner in Redding, California. I know she likes IPAs, and so tell us a little bit else, something else about yourself.
I know it's criminal to live in wine country and not like a lot of wine. But I have a practice with my husband, who's an otolaryngologist, ENT facial plastic, and we've been in practice since 1999, so 22 years already.
Wow.
Yeah, and I'm proud nurse practitioner and a proud aesthetic nurse injector.
That's great. Well, we're going to have a lot of fun, so stay tuned, and there'll be a Q&A at the end. We'll go through a lot of the commonly asked questions, and we'll talk a little bit about the science, so bear with us. It's going to be an amazing time. Okay, so what is cellulite? It's been, there's been a whole, lack of long-term options for the treatment of cellulite. But we're so excited to present something that really works. The first FDA-approved injectable treatment for moderate to severe cellulite in the treatment of adult women buttock cellulite. So to set the stage today, we're going to introduce what QWO is, provide an understanding of how it is thought to work, and then share with you some of the phase 3 clinical trials, so bear with us when we do that, and then how you integrate it into their practice. And I think Julie and David are going to do an amazing job of talking about the do's and don'ts and how to talk about it and how to do it. So let's transition to talk about cellulite. So we know that cellulite does not discriminate. In fact, it affects 90+% of women regardless of age, race, or body weight. So does this align with both your practices, David?
Yeah, absolutely. I mean, cellulite is an equal opportunist among women. And I like to refer to that statistic quite often, that 90% of women are affected by this. And of the women that I've treated with QWO, and we're part of the preview program, there's no comparison. They're all different. They're all different ages. They're all different body weights. They're all different races. So I think that's a very interesting statistic, and I think it really closely aligns to what I see in practice. Every woman has the opportunity that I could talk to them about cellulite because it affects 90% of them.
Yep, I agree. Julie, why do you think there's so much misunderstanding about cellulite, and how do you phrase that with people?
Yeah, well, I really think that it's not something that we talk about with our girlfriends at lunch. It's pretty it's pretty embarrassing a lot of times, and I don't know about a lot of my friends, but I always assumed that it wasn't really 90% of us. I thought it had to do with what I was eating, how my lifestyle, that I wasn't exercising enough, and I always kind of shame myself, and I don't think I'm alone on that. So I really think that it's up to us, knowing these statistics, that we should really put it out front and center and really spread the awareness that it's most of us, 9 out of 10 of us, and I think stop the shame game on this.
Yep.
And make it out there. Yeah,
I agree. So, cellulite is associated with some 3 structural fracture type of factors. So, do you want to talk a little bit about that in this slide?
sure. So if you think about what cellulite is, it's really 3 factors. You've got the fibrous septae, which are really pulling down to the underlying structures, and the fat lobules start to protrude. And as those kind of separate and protrude, unfortunately, as we get older, our skin gets thinner and thinner, and that makes it even worse. So it's really these 3 factors together that cause this sort of tufted couch appearance. So if you think about it, like a tufted couch has these little buttons and a string pulling down, and if you cut that string, it's more smooth and more it looks better, right? So that's kind of how I explain cellulite to my patients as well.
Great. You know, and Endo's also put together a lot of science on this, and they've actually put together, I think, a very worthwhile video that actually does a really good job of helping us understand what is cellulite and really how this new product works in breaking it down and making it a permanent solution. So let's roll this amazing video.
Quo is a combination of purified bacterial collagenases indicated for the treatment of moderate to severe cellulite in the buttocks of adult women. Affecting approximately 90% of women, cellulite presents as a dimpled appearance on the skin surface. Beneath the surface of the skin, fat cells separated by an architectural network of collagen-rich connective tissue called fibrous septae tether the dermis to the deep fascia. There are three main structural factors that are associated with the appearance of cellulite. First, women with cellulite tend to have thicker and more rigid fibrous septae, which may cause tension in the dermis. Fat lobules that are segmented by fibrous septae begin to push against the skin, and the dermis becomes thinner. Together, these three factors contribute to the dimpled appearance of cellulite. Quo is the first and only FDA-approved injectable specifically designed to treat moderate to severe cellulite in the buttocks of adult women. Quo is contraindicated in patients with a history of hypersensitivity to collagenase or to any of the excipients or the presence of infection at the injection sites. After reconstitution, Quo is injected subcutaneously under the surface of the skin at the dimples. Quo is a mixture of two purified and highly specific collagenase enzymes, OX1 and OX2, which work synergistically to lyse type 1 and type 3 collagen in fibrous septae and the extracellular matrix. The exact mechanism of Quo for the treatment of moderate to severe cellulite is unknown. After Quo is injected, enzymatic subcision and remodeling, or ESR, begins. ESR is believed to initiate as the enzymes work on the fibrous septa to release the cellulite dimple. With the fibrous septa detached, fat lobules begin to reorganize and spread more evenly. At therapeutic concentrations, the enzymatic activity of Quo does not damage arteries, nerves, and large veins themselves, since these structures contain type 4 collagen. Small venules that are supported by the extracellular matrix may leak, causing bruising as their support is affected by Quo. In clinical studies, injection site bruising occurred frequently after Quo administration. This enzymatic activity stimulates neocollagenesis. From within, this collagen support network rebuilds itself in the extracellular matrix with thinner, smaller septae. These subdermal changes reduce tension and help thicken the dermis, creating a smoother appearance.
Well, that was amazing, and I think there's a lot of detail in here. But so, what do you think are the most important things that you should take away from this this video regarding Quo and how it's thought to work, David?
Yeah, I tend to try to keep it as simple as possible. So first, when I'm talking to patients, Quo will break down the fibrous septae. So it's going to help sever the tether on the skin. That's the first thing it does. Second, the fat lobules that are protruding around that little string pulling the dimple down are going to reorganize and smooth out, resulting in a more even, smooth appearance. And then third, because it is a collagenase, you do get neocollagenesis, so you're going to get new collagen formation in the area, which is going to improve the skin texture and skin thickness and overall skin appearance. That's as simple as I can make it.
Yeah, no, I agree. So in summary, you tell them, okay, how is it thought to work if I'm a patient? What's the bottom line?
Yeah, this is an injectable treatment. A lot of my patients are familiar with injectables. I say this one just targets that little band that tethers down the dimple in your skin. You're going to need 3 treatments so we can target that band effectively over and over to give you a really nice improvement in the long run.
Yep. I think that's very well put. You agree, Julie? Yeah.
Yeah, definitely. And going back to my tufted couch analogy, they get it. You know, I'll say
Right.
it's an injectable enzyme that basically cuts that that darned thick rope holding down your skin, and they get
Yeah,
it. And
I like that.
keep it
I
simple.
like it.
Yeah.
So, since 2012, Quo has actually had done 14 clinical trials in over 1,800 subjects with 4-year follow-up. So that represents the largest clinical study program for cellulite. And I really like that as an editor because this is real science. So I'm going to give you a very 10,000-foot level view of the science, and they're incredible studies. They've done validated scales on cellulite severity, from 0 to no cellulite to severe cellulite, and they've studied it at baseline of day 1, 22, 43, and 71. And they did both physician and patient analysis independently, and then they did a combined one to look at this severity scale, which I think is very important to do that. And the primary endpoint had to be a 2-point level of improvement for both the patient and the physician in the cellulite. And I think that's very important. So let's look at this phase 3 clinical study to see what they found in the safety and efficacy. And really what's important to find in this study was that they enrolled a very diverse group of women with regardless of BMI, age, and even Fitzpatrick skin types. They included women from age 20 to 70, so they got the whole spectrum, and that's very important. The BMI also ranged from 18 to 67. The majority of them were in 25, and they had a broad spectrum of Fitzpatrick patients. In fact, 40% were from age Fitzpatrick's 4, 5, and 6. So I think that's very important because so few clinical studies include this diversity types of patients. So this study really summarizes the data at the endpoint of the primary and secondary endpoints. It's important at day 71 of the Release 1 study. And really what it shows was that the composite 2-level improvement, meaning both the physician and the patient assessment, compared very favorably to 2 levels. And this was comparable to what both the patient and the physician did compared to the placebo. So it was categorically significant at each level, both alone with the patient, the physician, and then combined. So, but one thing that sometimes people ask, David, is what about those patients that had a low BMI in this study?
Yeah, interestingly enough, they extrapolated the data and did an ad hoc study to look at what or how younger patients with lower BMIs responded.
Right.
And interestingly enough, the response rate for that 2 composite score, and that's really important to note because that means that the physician and the patient has to agree that there was a 2-level improvement on a 4-point scale. That's a 50% improvement depending on which way they're going. So that's really significant. But what they found when they looked at the data for younger patients and then patients with a lower BMI, that the 2-point improvement of the composite score actually almost a little bit more than doubled the responder rate.
Yep.
So that's incredible.
Yep.
And we see that a lot in aesthetics. And I think with such a broad study of 1,800 patients, such a broad study of so many ages, so many different actual ethnicities, it was interesting that they extrapolated that data to show what we see in aesthetics all the time. Younger people, healthier people tend to respond better.
Right, and certainly that parallels with, I think, both Julie and your clinical practice. And this study was really amazing in doing that, both at the 2-level, but also at the first level improvement, which paralleled the 2-level improvement. So this actually, this data actually shows the release and the pool data from both Release 1 and Release 2. And it really was similar. Even at a level 1 improvement, the amount of improvement both for the composite, the physician, and the patient study was significantly better compared to the placebo control patients. So that further validates this study, which is really, I think, is an important aspect. Now, the studies also use a validated scale, which I really like, at specific endpoints throughout this trial. It was a 5-point scale from 0 to 4. 0 meaning no cellulite, and then severe cellulite at level 4. So, Julie.
Well, first of all, I think it's nice to show them this visual because a lot of patients have no idea what a 1-point or 2-point reduction in cellulite means, right? So this is such a good visual because if I, say their cellulite was severe and I said, would you be happy if it was, and I point to a mild or a moderate, if it had that much improvement? And then they understand and they're kind of on board with me, because when I'm consulting with somebody, I don't want to use words such as, oh, this enzyme will get rid of your cellulite, or your cellulite will be gone, right? I want to be realistic with them so that they're happy with their end results. And I think by showing them scale and asking them if at least a 1 point, if it would be worth it for them. And yeah, I think that for most people, getting an improvement of this kind of a big jump is exciting for them.
Is the adverse events, which are always, as noted in clinical trials of this type. So bruising, of course, is the most common AE, 84% of patients in the treatment group. So let's talk a little bit more about this for a moment. There was also some pain and nodules and pruritus that were noted, but it's important that this didn't correlate with the bruising at all. And I think that correlated with both what Julie and David's experience has been as well. And there was discoloration and swelling, and then of course but all of these reactions were gone in 21 days. So David, does this align with what you see in your practice as well?
Absolutely. And one thing that I think is interesting when we're doing these studies, when you look at AEs, I don't necessarily align bruising as an AE. It's an expected outcome from the treatment and the way that the treatment works. So I tell patients, absolutely, you're going to be bruised. You're going to look like a month-old banana. We're going to get through this. What's more important, getting rid of your cellulite or having bruising for a month? Yeah. What I do find interesting is that subsequent treatments, and there's a great graphic for it, the bruising is not as intense. There's no rhyme or reason that they've studied or told me about or why that is. But in my personal experience in practice, the first treatment has a significant amount of bruising and subsequent treatments aren't as bad. Now, as far as tenderness, you're injecting someone's buttocks. They're going to be tender. Right. Okay, there might be a little bit of firmness, but it's not anything that any of my patients have ever said, oh my God, please call in pain medicine for me, or oh, I need a ibuprofen. It's typically, they sit down and they're like, oh, okay, yeah, I got some injections in my butt. But it's not something that's bothering them throughout the day. Right. And again, they're happy to get rid of their cellulite.
Yeah, no, I know. And of course, AEs, this is an FDA trial, so we have to say anything in an FDA trial, those of you who've done it, we have to report everything. So Julie, you agree with that?
Yeah, I totally do. And I have to say, in addition, I would forget that I even had it done, and talk to other people that I injected. Same thing with them, and only when we sit down do we remember, oh yeah, I had something done. So it's not, I wouldn't call it a painful procedure at all. I would just say, every time you sit down, just for a couple seconds, you're reminded. Yeah. But definitely, the bruising is something we should put out front and not think of it like an adverse event. Just like David said, just kind of be honest about it, because that first treatment, it's pretty significant, probably like nothing they've ever had before. Right. So I really like the graphic that we can show our patients as well. Right. For that.
No, I agree. And I think, when you tell people about something in anticipation, it's a sequelae. It's not an adverse event, but because it's what they can expect. So, why quo? Why should we use quo? And I want to ask both of you that. And how does it differ from how you've treated cellulite in the past? So, Julie, we're going to start with you.
So for me, I live in a small town, Redding, California. It doesn't have a lot of really wealthy people at all. So there's been other modalities we've tried over the years, and they can see some improvement with those, but some other modalities can be quite expensive. So there was really nothing done specifically to enzymatically erase those tethers of the fibrous septae. So for me, it's kind of nice that they know what to expect with a cost up front. They know it's going to be 3 treatments, and I could show to the point improvement scale and kind of set the stage for realistic expectations. So to me, it's been exciting because all of our patients have been happy and they've all seen differences in their results. And for me, it's like a lot less expensive than other things we've tried.
David, what about you?
Yeah, I agree with Julie on that. There's been several predecessor treatments that gave questionable results, and there's been other treatments that are much more invasive than Quo. Quo is an injectable treatment. It's just as easy as doing a neurotoxin in your office. It's very simple to perform, very straightforward. The patients receive it really well because most of my patients have had injectables before, or at least had a flu shot, so they know kind of what to expect.
Yeah. Yeah, and I think I like Quo because I like the science behind it. I know that I know the science. I know how it works enzymatically, and the bruising is part of that. But it works, and I think that's what people want to see. So many of the past ones had things and it didn't work, so I like that. So I think Endo has also communicated this well in their direct consumer marketing and other things that they've been focusing on. In fact, they've won several beauty awards for this. But tell me how each of you address it in your office. How do you approach them about Quo? How did they hear about it? So Julie, let's start with you.
So in our office, we do a few things. One is we have a sushi menu. So, when they're waiting for us, they can check off, certain things that they see visually by photograph. So we'll have photographs of frowns, photographs of wrinkles, and photographs of cellulite. And if they check the cellulite box, then, I am happy to talk to them about it, and it kind of opens the conversation.
That's a California term. So basically, it's a visual.
Yeah.
It's a visual. So they're not. So
Yeah.
it's like it's very millennial. So you just say, "I want this fixed." Huh? I want.
Yeah, if you see something, a picture of something, you check the box next to it, and
I love it.
we talk about it. Yeah, exactly. And then, secondly, we also have Instagram in both my private practice and as a teacher, and also our office. So we posted several things on Instagram, and that's been really successful because patients will message us and say, "Tell me more," and it can just start the consultation, get that going. So yeah, I think you have a video.
Yeah. So let's look at your Instagram.
It's embarrassing to have my butt out there, but this is my butt. This is day 2, the bruising on day 2 after my first one. Day 3, you can see it's getting a little more purple, and it matched my sweater nicely. And I saw the most bruising on day 6, right? And then from there, it just started going down. This is just an up close at the same area. I had more dimples on my right buttock than my left, so it got so clearly I got more bruising on there. But I will say that I just make it fun for my patients. Like I'll say, "Hey, look at mine here. What does it look like?" It's kind of like a Rorschach test, a psych test. And then I'll have my patients send me pictures of their bruising too, and we just make it kind of expected and fun. But I will say that the second treatment, I had about 50% of the bruising. And the third treatment, I barely got any bruising at all personally. And most of my patients report that. For some reason, just like David said, there's way less bruising by the third treatment. So I do believe that there's some really exciting things happening under there that we don't even know about. But yeah. Most people notice that their buttocks are just firmer and thicker and tighter and just rounder.
Yeah,
nice.
No, I like how you've personalized it, and I know in Dallas, I think we don't call it the sushi menu. What do you do? And you have an Instagram. I haven't seen your butt up there though. I mean,
no.
But so tell us, what do you do in Dallas?
Julie, thank you for sharing your personal story and your butt to the whole world in for Quo.
All the name for
exactly. We were talking that maybe I'm a male. We're not as tasked with cellulite as much, but I think I might try it just so I can have the same experience as Julie. Now, as far as incorporating it into my practice, it's very easy. You don't have to have a really big marketing budget. When I bought into Quo, they sent me this really beautiful banner that I have in my lobby, and women walk past it, and it's a great before and after picture of the expectations you can set with Quo. And I get them in the room, and they're like, "Hey, what's that? Why is someone's butt in your office? What is that? Do I need that?" And then that opens the conversation about Quo. Secondly, I do a lot of skin tightening procedures from head to toe. So if I am consulting with a patient and I'm assessing them on what I think is going to be the best treatment option, some people have skin laxity and some people have cellulite and some people have both. And it's important for us as providers to be able to distinguish it and to treat them appropriately and bring up the conversation. Another thing is, as far as Instagram, I'm terrible at Instagram. I try to be good at it, but I'm terrible at it.
He really isn't. He's pretty good.
I try. But there's an interesting statistics that I read somewhere, this is years ago, that says, it's easier to get 5 patients of your own to buy onto something new than it is to get a new patient in your office. So, we have thousands of patients. It's not that hard for me to incorporate into what I'm talking to them about because I'm treating them holistically from head to toe. As far as marketing, I did a couple Instagram posts, but the majority of my clients have come from my existing pool just because I brought it up or they saw the picture in the lobby.
Yeah, and I like that. And I think both of you, it kind of gets back to your sushi menu. It's visual, what you do. So that brings us up to, who is an appropriate patient? Okay, so what do you think? Julie, I'll start with you. Who do you think is the ideal patient and who should you exclude?
So I would personally exclude anybody who just had simple laxity. So if they clench their buttocks and it doesn't look that much worse, it could be just solid laxity and that's their only problem. And I think those patients won't have that really great of a result as the people with, true cellulite. So I do have this conversation because I think most people in their late 40s, early 50s coming in probably have a combination of both. They probably have laxity and some cellulite issues as well. And honestly, I think that's what I had, a combination of both. But I was pleasantly surprised that my buttocks were even more firm and more round after it all. So I do think that we shouldn't exclude people that have laxity, but we should do our best to determine if they actually have those septi pulling down on their skin. Yeah.
That's awesome. David, what about you?
Well, identifying the correct patient is key. And as Julie said, laxity versus cellulite versus laxity versus cellulite. You have to be able to identify both. I haven't honestly had a single patient come into my office that I have not treated. Okay. Now there are patients that I absolutely say, you need to start with this procedure before this procedure, or we should try Quo before this procedure. So really assessing that patient. The next thing is setting up that realistic expectation. You have that great graphic. I have one, there's actually a chart here that's in my office that goes over expectations, the bruising, everything in this little nice, lovely flip chart. And I use this every time I'm with patients. I say, this is what you want, what to expect. And is that enough improvement, or is that, going to make you happy? It's always easier to under-promise and over-deliver than the opposite. You always want to be the hero in the end.
Yeah.
So really selecting the correct patient. Now with that ad hoc study that they did extrapolating the data, I do find in my practice that younger patients with a lower BMI respond much faster and end up having a significant improvement.
Right.
Not that my older patients or higher BMI patients don't, but it just takes a little bit longer. And just being able to identify that in your patient's age group, in their lifestyle, making sure that you explain that to them, so your patients all across the board end up happy with the treatment.
Yep. It's visual. Everybody wants something visual. In fact, I think you have some photos here you want to share with us about. This is one of your patients that you treated. So tell us about this patient.
Absolutely. This is one of my very first patients that I treated. You can see that she's a younger patient. A moderate BMI. The interesting thing about this patient, though, and it's somewhere in the fine print on this slide, is I actually lost this patient to follow-up. So this is only after 2 treatments. So this is before her 3rd treatment. So when I'm doing my consultation and doing the treatments on the patients, I incorporate their pre-photos in a mirror and a hand mirror, so we can talk about what's happening to their body. And I find that if you incorporate that structure into your actual treatment, the patient gets excited to come see you. Like, they forget about the bruising. They're like, oh, I get to go see David today. My cellulite's getting better. And they really like it. So, this is an example of what a younger patient.
Tell us about, but I want to ask both you and Julie, so how many complete the treatment of 3. This one didn't. I mean, that should be uncommon, or no?
No, this one actually, I mean, for on label, she actually completed the 3rd treatment, but she moved to Florida. So I couldn't follow up with her final treatment.
So most patients complete it.
I just wanted to showcase that even throughout the process of 3 treatments, you see improvements as you move along.
I agree. And then you have another one here.
Yeah, this next patient completed 3 treatments. Again, under the age of 40, lower BMI, and I think these results are incredible. I mean, she was thrilled with it. I didn't think she had terrible cellulite or a severe cellulite to begin with, but the marked improvement that you can see left and right, not only in the smoothing of the skin, but the overall firmness and the appearance of the skin is greatly improved, not just the cellulite.
Yeah, no, I agree. And then I just wanted to show a couple of things these are from the study. These are from the clinical study, not my patients, but this is an example of a 2-level composite improvement, both from the physician and the patient. You know, Fitzpatrick 3, BMI of 17, 48 years old. You can see at day 71, that's pretty remarkable. And then here's another patient from the study that had another 2-level improvement, 52 years old, Fitz 2, BMI 23, and she had another composite 2-level treatment. So that's pretty impressive. And when you take a look at this patient, she also had a grayscale image to show it much more dramatically, the incredible improvement that you saw in a patient. And this comes from the phase 3 study that was done. And this is at day 71 after the 3 treatments. So I think these are very reasonable things to do. So Julie, that parallels what you have seen as well, and certainly we've seen in your photos. So So now let's open it up for questions. I think we have some time. I think we have about 10 minutes for questions, and we'd like to take your questions about all of this that we've talked about, the science, how to introduce it to your patients, how do you market it, what do you say, what do you do, what don't you do?
Any keys that we should take away?
Yeah, and I think the other thing is, what are the key points that you should take away from this? And I want to ask, before we go to that, I want to ask David that, and what are the key points that we should take away?
So key points for me, since I've had it in my practice, is to make sure that you identify the patient properly, treat the patient properly, and set up the expectations for the patient properly. Okay. And Julie mentioned this early on, if you say we're going to get rid of your cellulite, or we're going to cure your cellulite, you're going to get yourself in trouble there. I use words like improve the appearance. Do you want to improve the appearance? And honestly, in some patients, we get rid of their cellulite. It is, but it's easier to just say improve the appearance of cellulite. Right. The other key takeaway is that you don't have to have a big marketing budget. Just, dip into your own patient population. They're out there. 90% of women have cellulite, so 9 out of 10 patients, if they're women, come and see you that day. You can talk to them about cellulite. Some might be bothered, some might not be bothered, but you're not, spending time on Instagram or spending a lot of money trying to promote it when you have all these patients coming in your doors anyway.
Yep, I agree.
The third last pearl I will give is really excellent before baseline photos, because your 2D images, for some reason, every once in a while you'll get a patient and you can see the marked improvement. And this is anything that we do aesthetic. You can say, oh my gosh, you look 10 years younger, and they're like, I don't see a difference. So you have to make sure that you have really good baseline photos. Endo & Co has been really great at providing great photography training to us. So we have a very set baseline, systemic set of photos that we do before each treatment, so we can see the progression. But those would be my little pearls.
Those are 3 great points. Julie, what are your key points?
Yeah, I'm going to first piggyback on what David just said, because even my very first before photo was taken at an angle down and not straight ahead. So, and also you could see that I was sitting on a patterned skirt. So you can see the pattern of my skirt in my thighs, and it's just so annoying. So yeah, I think photos are a big deal. Just get it right the first time, because you can't turn back the clock. I also, another pearl is to absolutely be 100% honest with your patient.
Right.
Be honest about the expectations, about what the improvements might look like. Be honest that, hey, that this might be mostly laxity and what we don't know, right? And also be honest about the bruising. And a lot of people are concerned about shadowing post bruising. And in clinical trials, it all resolved within a year. So I do set my patients up and say, hey, you know what? You might have shadowing for up to a year. Will that bother you? And if their answer is yes, shadowing will bother me, then maybe they're not a good patient for me to inject, right? So far, all of our patients haven't been bothered by it at all, but I know there are patients that could be. And probably third, don't be afraid to put it on social media. It is, a free way to
Right.
advertise, and talk about your own experience. And I do think, David, you should definitely get it done just so you can speak to it. And I want to hear about it when you
Yeah.
get it done too.
Yes.
I've done.
And then also, I don't consult and treat the same day. And the reason I don't do that is I want to set them up and be prepared with their 3 treatments 3 weeks apart, pay for it all at once so that they don't have to keep paying. I think that increases the compliancy for everybody. And I have them go buy some compression garments or Spanx, and I have them wear it for about a week after the treatment, just to reduce, at least give them something to do to reduce the chance of the bruising.
That's great. So managing their expectations, being honest and upfront, getting good photography, and then use your existing patients. I mean, all of those are winners, especially when you have a product like this that truly works. So well, let's get to some questions. There's actually a lot of them. So I'm going to bounce back and forth from each of you. So how many dimples per buttock can be treated in a single session? David, why don't you take that?
So when you think of the vials themselves, if we're speaking on label in the study, there was a vial that will do up to 12 dimples and a vial that will do up to 24 dimples. And I'm not going to speak out of turn and tell you how many per side you can do because I honestly don't know. But what I would say is that even when I use the larger vial on the 24 dimples, you see improvement across the entire buttock. So as I'm going through treatments, I might not be, I typically am not treating the same cellulite dimple over and over.
Right.
So if you have someone that needs 24, the 24 vial or 24 dimple vial, I would start them there, bring them back in 3 weeks at that next treatment and see if they need an additional 24 dimple vial, and then bring them back again at the third treatment, see if they need a third additional 24 treatment vial.
Okay. Julie, do you have any suggestions on the best approaches to introduce patients to QWO when they're in their office for medical treatments or facial aesthetic treatments? I know you touched on that.
Yeah, I do think that having a visual for them is important. Like for David, he's using that great big banner, and we're using that too. But for a lot of offices, they might not have the space for that. Definitely employ a sushi menu because that really does.
I like that. I like that a lot. I like that. I think that's great. Okay. Do you use cellulite severity scale with photos and consultations, David, so that patients can assess themselves against your assessment?
Absolutely. And that's just really just setting up realistic expectations, because if I believe they're a grade 4 cellulite and they think they're a grade 2, then we need to have an honest conversation. And vice versa. If a lot of my patients honestly come in and they think they're a grade 4, but I'm like, you're really only a grade 2. So this is where we're starting and this is what I can possibly get you to. So just setting up that real expectation. And a photo's worth 1,000 words or 1,000,000 words, whatever they say. So if you have it in your office, why not use it?
Yeah, no, it goes along with what both of you said. Photographs, informed consent, under promise, over deliver. So, Julie, what is your overall satisfaction with treatment in your patients?
Well, so far everybody has been really happy. I did have one patient who was really kind of upset about the bruising, and she just felt better when I told her that everybody in the study was, by a year, it was resolved. Because sometimes patients just think, is this going to be forever? And forever seems really, really daunting. But I say that's the only kind of line patient that wasn't like jumping through, jumping up and down with excitement. But everybody in our office initially was super excited, and I think that sort of springboarded us to be, really up close and personal with our patients and talk about it. So if you want to bring this on, I highly recommend getting the whole staff treated first.
Right. I think that's great, and also you showed your own on Instagram. I think that's a great equilibrator, don't you think? And I think it's good to see that. So
Crazy like that.
no, it's great. So David, how are you integrating Quo in your practice in terms of total visit time, from photos, marking to injection to time prone, et cetera? That's a good question.
That's actually an excellent question. And I think anything that we do in aesthetics, the more we do, the faster we get at it. I will say in our practice, I'm a little spoiled because we have a photo studio. I just call them, I send them down there, they get photos, etc. So that doesn't really constitute my treatment time. However, in the beginning, I was scheduling the first treatment 45 minutes just to allow for any hiccups. However, the treatment itself only takes about 5 minutes. Now, even though I do have a nice photo studio, I take my own payments, I book my patients' follow-ups, I hold their hand through the process, I mix it in the room with them. So realistically, because I'm doing all of that, I don't have an MA or someone in the room handing me syringes or preparing the drug for me. I would book it for at least 20 to 30 minutes, depending on how fast you are.
Julie, is that parallel what you do, or?
Absolutely. Yeah. I think at first it took me longer just because it wasn't rote memory, but now it's so easy. It just comes second nature, and the injection pattern couldn't be easier. If you're going to do it, it's just, one poke and 3 little angles.
Right.
It's,
pretty quick.
It's just easy. Yeah.
It's quick.
It's the prep that takes a little time in the beginning.
This other question is, how do I get to Quo? I'm going to show you this scan QR code at the end here, where you can hear from your local aesthetic expert. So can both of you speak about the side effects and how you really prepare your patients? I know both of you have talked about that, but what is like the one key thing that you have to talk to them about? Obviously, bruising is a big thing, showing in pictures. So, but I guess it's important because that was asked again. So tell us about that, and I want to ask you about that, Julie.
Well, I think I'm going to have to bookmark Julie's Instagram so I can share that with the patients before I have my own.
Say, I know her.
I'm not quite sure if my patients would love to see my own results or not love to see it. That's probably a 50-50. But, just setting up the expectation and going over, Quo provides you this nice little pamphlet as well as the flip chart that I referred to earlier that gives really nice pictures of exactly what to expect. And if you go over that with them several times during the consultation and at their first treatment visit, because patients only hear, what they want to hear. You have to hit them a couple times with the facts.
And you can give them the brochure, right?
Yeah, you can give them the brochure, so
that
that they know what to expect. Just make sure that you hit it several times so you kind of drill it into their memory what is going to happen. And from there, Julie, do you have any other advice?
Yeah. What do you think?
Yeah, my office is so good with giving these little take-home cards about this big, 4x6 cards that just talk about every procedure we do, the before, the during, and then the aftercare. And we haven't done it yet, but I hope to make one of those cards up for them so they could just walk out with it. Because a lot of times they forget things that we tell them in the consultation because they're nervous. And people are going to be nervous when they're talking about their tushy, So,
right.
So I want them to go home with something that they can remember, aftercare stuff, like perhaps wear the Spanx for 8 days, don't get into a hot tub the same night, with all those open needle folks.
Right.
Don't jump into a lake, the do's and don'ts of aftercare. Just make them feel a little bit more, comfortable with it. Because, talking about things like the lumps and bumps, that's normal. They might touch their tushy a week later and go, oh, I still feel a little lump, a little hardness. But I think if we have it on a piece of paper that says all this is normal and expected, they feel a little bit better about it.
Yeah, I think that's important. They need to see it, hear it, and then be able to talk to you about it, if they have a question. So there's another good question here for both of you. Can you talk about your personal experiences with patients of color, with darker skin tones, and also larger BMIs?
Absolutely. My first thing when I saw this question is that um, I, in my personal experience, find darker skin tones don't bruise as badly, and the bruising is a lot more mitigated, a lot faster. My second opinion on the larger BMIs, every person that I come in contact with that has gotten improvement from Quo, regardless of their BMI. Now, if you have someone who's morbidly obese and has more than 24 dimples on their buttocks, you might set them up for multiple treatments.
Right.
It's not, they might not just be, the 3 and done that the study says. If you're having to treat their lifestyle and their body habits outside of the normal parameter of what the study is, you just have that conversation. We might have to do a couple extra treatments, and will you be happy with that if that's the case?
Julie? Large
Yeah,
BMIs
so
and skin.
same thing with us. I find that the shadowing almost shows up more on people that are white, because I think there's more of a contrast. Like the lightest skinned of all of us had the most shadowing in our practice and in our patients. But yes, and I think that the people with the lower BMI do show more of an improvement. So I just kind of set that stage right in the beginning too. But I used to assume that darker skinned people would have darker shadowing, but I really did find that it was the white chicks like me that it showed up more.
Yeah. And that kind of segues to this question about marketing. Quo, I know for social media in your office, I know when we first introduced Quo, you and I injected it, and we did a Instagram on it, and then actually we did a YouTube on it, and actually got a lot of interest and a lot of, and like I think David said, it really brought a lot of patients, my patients, which are over 90% female, to the office, say, hey, you finally have a treatment for it. So David and Julia, you want to add anything else to that?
I mean, really just talking about it in your office. I mean, I work for Dr. Rourke here, so he's a plastic surgeon. He's evaluating patients for surgery, liposuction, BBLs, etc. So if he notices that cellulite's a problem, he'll say, hey, you need to go see my NP and, fix the cellulite while you're waiting for your surgery, or vice versa, do it after your surgery. And really just reaching out to your own patients. I mean, I haven't really spent a lot of time or effort really going out and trying to find new patients for Quo. They're all been my own existing patients.
Julie?
Yeah, we basically are mainly seeing our own patients as well, but I really think we should get it out more, especially like a lot of times when our patients come in, we're busy, where we've got a set schedule, running behind, and it's just typical. And I found that when we have more time with our patients, we can talk about more of the things on the sushi menu. And I really think we have room for improvement in our own office too, to be quite honest. It's just, I think we let our busyness get ahead of us, for sure.
Well, I agree. So we got just a few minutes left, and so I just want to obviously talk to you about, and these questions have been awesome. And if you have any other questions, please feel free to contact Quo and certainly any of us. We can give you our Instagram handles at the end of this as well. So this is just a product information that we talk about the safety of Quo, both its indications and contraindications. And then there was a question about, how you can contact somebody if you want to integrate this into your practice. This is a QR code you can just scan in your phone. You can easily get that, and then someone will be contacting you about this. So I just want to again thank both of you. Julie, thanks so much. It was amazing. I learned a lot, and David, likewise. Every time I do this with you all, I learn a lot, not only about you, but also about the finesse of what you do in your practices. So kudos to both of you. Thank you again so much.
It's nice spending the night with you guys.
All right, likewise. Enjoy.
See you soon.
You bet.